Hyperparathyroidism. Introduction. Parathyroid hormone, PTH, also called parathormone or parathyrin, is a hormone secreted by the parathyroid glands that regulates the serum calcium concentration through its effects on bone, kidney, and intestine. PTH, the most important regulator of body calcium and phosphorus, is a protein hormone secreted by the parathyroid gland. PTH increases calcium and phosphorus release from bone, decreases the loss of calcium and increases the loss of phosphorus in the urine, increases the activation of 25-hydroxyvitamin D to 1,25-dihydroxyvitamin D in the kidneys. Secretion of PTH is regulated by the level of calcium in the blood. Low serum calcium causes increased PTH to be secreted, whereas increased serum calcium inhibits PTH release. Normal values are 10 to 55 pg/ml. Normal value ranges may vary slightly among different laboratories. Note: pg/ml is equal to picograms per milliliter. Definition: hyperparathyroidism is when parathyroid glands create too much parathyroid hormone in the bloodstream. This hormone helps maintain an appropriate balance of calcium in the bloodstream and in tissues that depend on calcium for proper functioning. Hyperparathyroidism is an increase in parathyroid hormone, PTH, levels in the blood. This occurs from a disorder either within the parathyroid glands, primary hyperparathyroidism, or outside the parathyroid glands, secondary hyperparathyroidism. When symptoms occur, they are due to elevated blood calcium. With long-standing elevation, the most common symptom is kidney stones. Other symptoms may include bone pain, weakness, depression, confusion, and increased urination. Both primary and secondary may result in osteoporosis, weakening of the bones. Causes: primary hyperparathyroidism. Primary hyperparathyroidism occurs because of some problem with one or more of the 4 parathyroid glands. A non-cancerous growth, adenoma, on a gland is the most common cause. Enlargement, hyperplasia, of 2 or more parathyroid glands accounts for most other cases. A cancerous tumor is a very rare cause of primary hyperparathyroidism. Primary hyperparathyroidism usually occurs randomly, but some people inherit a gene that causes the disorder. Secondary hyperparathyroidism. Secondary hyperparathyroidism is the result of another condition that lowers calcium levels. This causes parathyroid glands to overwork to compensate for the calcium loss. Factors that may contribute to secondary hyperparathyroidism include: severe calcium deficiency. The body may not get enough calcium from diet, often because digestive system doesn't absorb the calcium from it. Severe vitamin D deficiency. Vitamin D helps maintain appropriate calcium levels in the blood. It also helps digestive system absorb calcium from food. The body produces vitamin D when skin is exposed to sunlight. Client also consumes some vitamin D in food. If client doesn't get enough vitamin D, then calcium levels may drop. Chronic kidney failure. The kidneys convert vitamin D into a form that body can use. If kidneys work poorly, usable vitamin D may decline and calcium levels drop, causing parathyroid hormone levels to go up. Chronic kidney failure is the most common cause of secondary hyperparathyroidism. Some medical treatments, such as vitamin D, bisphosphonates and cinacalcet, will lower PTH levels. Tertiary hyperparathyroidism. In some people with long-term end-stage kidney disease, the parathyroid glands enlarge and begin to release PTH on their own, and PTH doesn't go down with medical treatment. This is called tertiary hyperparathyroidism, and people with this condition may require surgery to remove parathyroid tissue. Risk factors. People may be at an increased risk of primary hyperparathyroidism if they are a woman who has gone through menopause, have had prolonged, severe calcium or vitamin D deficiency, have a rare, inherited disorder, such as multiple endocrine neoplasia, type 1, which usually affects multiple glands, have had radiation treatment for cancer that has exposed neck to radiation, have taken lithium, a drug most often used to treat bipolar disorder. Sign and symptoms. Sign and symptoms may be so mild and non-specific that they don't seem related to parathyroid function, or they may be severe. The range of signs and symptoms include osteoporosis, kidney stones, excessive urination, abdominal pain, tiring easily or weakness, depression or forgetfulness, bone and joint pain, frequent complaints of illness with no apparent cause, nausea, vomiting or loss of appetite. Diagnosis. Blood tests. If blood test results show patient has high calcium levels in blood, doctor will likely repeat the test to confirm the results after patient has not eaten for a period of time. Many conditions can raise calcium levels, but doctor can diagnose hyperparathyroidism if blood tests show client also has high levels of parathyroid hormone. Additional diagnostic tests. After diagnosing hyperparathyroidism, doctor will likely order more tests to rule out possible secondary causes, to identify possible complications and to judge the severity of the condition. These tests include bone mineral density test. This test is done to see if client has developed osteoporosis. The most common test to measure bone mineral density is dual energy X-ray absorptiometry, DEXA. This test uses special X-ray devices to measure how many grams of calcium and other bone minerals are packed into a bone segment. Urine test. A 24-hour collection of urine can provide information on how well kidneys work and how much calcium is excreted in urine. If a very low calcium level is found in the urine, this may mean it's a condition that doesn't need treatment. Imaging tests of kidneys. The doctor may order an X-ray or other imaging tests of abdomen to determine if client has kidney stones or other kidney abnormalities. Imaging tests before surgery. If the doctor recommends surgery, he or she will likely use one of these imaging tests to locate the parathyroid gland or glands that are causing problems. Sestamib parathyroid scan. Sestamib is a radioactive compound that is absorbed by overactive parathyroid glands and can be detected by a scanner that detects radioactivity. Computerized tomography, CT, scanning may be combined with the Sestamib scan to improve detection of an abnormality. Ultrasound. Ultrasound uses sound waves to create images of parathyroid glands and surrounding tissue. A small device held against skin, transducer, emits high-pitched sound waves and records the sound wave echoes as they reflect off internal structures. A computer converts the echoes into images on a monitor. Management. Watchful waiting. The doctor may recommend no treatment and regular monitoring if calcium levels are only slightly elevated, kidneys are working normally, and client has no kidney stones, bone density is normal or only slightly below normal, client has no other symptoms that may improve with treatment. Surgery. Surgery is the most common treatment for primary hyperparathyroidism and provides a cure in most cases. A surgeon will remove only those glands that are enlarged or have a tumor. If all 4 glands are affected, a surgeon will likely remove only 3 glands and perhaps a portion of the 4th, leaving some functioning parathyroid tissue. Complications from surgery aren't common. Risks include damage to nerves controlling the vocal cords, long-term low calcium levels requiring the use of calcium and vitamin D supplements. Drugs. Medications to treat hyperparathyroidism include the following. Calcimimetics. A calcimimetics is a drug that mimics calcium circulating in the blood. The drug may trick the parathyroid glands into releasing less parathyroid hormone. Hormone replacement therapy. For women who have gone through menopause and have signs of osteoporosis, hormone replacement therapy may help bones retain calcium. This treatment doesn't address the underlying problems with the parathyroid glands. Bisphosphonates. Bisphosphonates also prevent the loss of calcium from bones and may lessen osteoporosis caused by hyperparathyroidism. Some side effects associated with bisphosphonates include low blood pressure, a fever and vomiting. This treatment doesn't address the underlying problems with the parathyroid glands. Complications. Complications of hyperparathyroidism are mainly related to the long-term effect of too little calcium in bones and too much calcium in bloodstream. Common complications include osteoporosis. The loss of calcium often results in weak, brittle bones that fracture easily, osteoporosis. Kidney stones. Too much calcium in blood may lead to too much calcium in urine, which can cause small, hard deposits of calcium and other substances to form in kidneys. A kidney stone usually causes major pain as it passes through the urinary tract. Cardiovascular disease. Although the exact cause and effect link is unclear, high calcium levels are associated with cardiovascular conditions, such as high blood pressure and certain types of heart disease. Neonatal hypoparathyroidism. Severe, untreated hyperparathyroidism in pregnant women may cause dangerously low levels of calcium in newborns.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.